So we used to have this thing called Warfarin, which is actually rat poison. My name is Vicky, I am a pharmacist, and I just started watching the Pitt, which I am so late to the game. But let's see if I can help you to understand some of the medical stuff that's going on in the Pitt, starting from season 1, episode 1.
AFib on a monitor.
So they just said AFib on the monitor. AFib stands for atrial fibrillation. It is when the atria of the heart can sometimes flutter. It often happens with old age or if you have like comorbidities. It is a fairly common thing, especially in the elderly population. So generally, if you have atrial fibrillation, you're going to be anticoagulated because atrial fibrillation is a major risk factor for stroke.
It's a lot more blood than expected.
He's probably anticoagulated for AFib.
And not surprisingly, they see that the patient is bleeding excessively. So we used to have this thing called Warfarin, which is actually rat poison. But it worked really well for anticoagulation. But the thing with Warfarin is that it was really hard to dose. Everybody has a different dose and it interacted with like anything and everything.
Check his medical record, see if he's on a DOAC.
So now we have newer agents called DOACs. They stand for Direct Oral Anticoagulants. And funny story, when I first started practicing pharmacy in a hospital, that's when the DOACs first started. And a lot of clinicians were really hesitant to use DOACs because there was no reversal agent. With Warfarin, can give vitamin K to reverse it. Not great, but at least there is something. But with the DOACs, there was no reversal agent at that time. I guess the best thing you could give is like frozen plasma. In the recent years, there are reversal agents that you can now give to the DOACs, which is why Warfarin has been phased out and pretty much everyone's on a DOAC now.
Stand by with 4-factor PCC if there's a brain bleed.
What's the PCC? No.
Clotting factors 2, 7, 9, and 10.
So the 4-factor PCC can be used to reverse DOACs, but they're not the drug that was developed for the reversal of DOACs. It was originally used to reverse Warfarin in emergency situations. But every hospital is different and every emergency situation is different as well. This hospital might not have the direct acting reversal agents on hand. And plus those agents get very expensive.